Kerry. Yes, my name's Nicole Ramsamy and I'm based in Queensland. I really enjoyed listening to your presentation, but also can understand your frustrations. As a health professional, I do find that, our services can be very muddled, and particularly that continuity of care is very, very difficult to provide in those remote contexts. So well done to what you've done to actually get the great care for your family. Well done. But as a nurse practitioner going forward in our day, it's certainly valuable because we're not having to have the many doctors coming into the rural and remote area, and that's a lot to do to their different medical models or personal needs or whatever, but also it can come back down to finances. I find with the growing nurse practitioner practice scope, and we just need to have a lot more support from the government to enable our practice scope to continue to expand so that we can actually then deliver a safer sort of service, so that we can actually not have to always be going back and having limitations in how we want to treat some of the patients in regards to what that we're seeing in front of us. One of the best things about nursing and nurse practitioners in the area is that we understand our philosophy and how we deliver that care. So continuity of care is very, very important. But also, the advanced clinical scope, and then now expanding our practice to the requesting different types of investigations is extremely vital. And because there's so many nurses in the rural and remote communities, that we're able to sort of have a better hand, I think, on what's happening at a local level and how things are playing out from a systemic perspective, but also from a regulatory perspective from how we provide our care. I honestly feel that that we really all need to be working together, and some of the biggest things that are letting us down is the different types of IT systems that are sort of across so many of our different service providers. So, if you're working for Queensland Government, or you're working for a private practice or Northern Territory in different places, you've got so many different places where you can go get your investigations done, but they all don't marry up or provide input back into your the systems where you're documenting or where you need to follow up care. So it's really, really hard to get your investigations that you've ordered. Some places have their own jurisdictions and how they regulate that, but some places it could be, they've got, understanding of agreements where they have memorandums where you can share that information. But again, it comes back down to a personal personalities thing, because of the inconsistent staffing issue and the transient, staff in those areas. I believe that a lot of the doctors as well coming from down south may not be familiar with these, particularly the rheumatic heart disease conditions in our, tropical climates, and particularly, it's always known to be, in your case, known to be affecting the Indigenous population. So particularly in those very, remote community where those socioeconomic statuses are quite significant. So, the way we're trying to train health professionals is to actually look out for that information and to provide that community awareness. I mean, even from that perspective, it's very, very difficult to actually, easily diagnose people with these types of conditions, simply because we may not also have a lot of the investigations readily available to us, particularly echocardiograms. People have got to go out and you've got to actually, that's part of the vital sort of investigations to actually classify people's diagnosis and also where they're at within their condition. So we're always going to have those concerns. And I feel a lot of the time that we don't provide adequate primary care to people as well. So, it's sort of a hit and miss. You don't get referrals from people because, and then if you go off to a place where you can get your test done, doesn't necessarily mean that you can actually get that procedure done at the time, simply because of the availability of appointments. So, or access to those referrals. So I feel that we've still got a long way to go. I do strongly believe that telehealth is one of our answers to actually look at resolving a lot of these issues that we currently have in the rural, particularly the very remote and rural and remote areas for everyone. And I think having that access to that continuity of that service provider is one of the most significant aspects of finding the solutions to and providing management to those clients at an earlier time, rather than extending the condition to become more deteriorated. So yeah, I feel that we need to be advocating for nurse practitioners to be going to rural and remote communities. I feel that we need to be able to extend our scope of practice, and also enabling us to be able to work in a private capacity with more Medicare entitlements that we could get for claiming our benefits and extending our practice scopes as well. So that's something that we need to be sort of looking at, and that's, we've got separate nurse practitioner chapters right across Australia, in Queensland, New South Wales, Northern Territory, and each nurse practitioner is certainly strongly encouraged to take part of these chapters, so that we can take a lot of these lobbying these concerns to the government regularly. So yeah, I think at a united front, nurse practitioners have got the best chance to actually help resolve a lot of these issues in the rural and remote communities.